This meeting is being recorded.
Voice out.
Good afternoon to one and all present here. I welcome all the participants back to the second session of the day. We already have our resource person in the online virtual meet. Welcome Dr. Hema Malya to the session.
Thank you.
On behalf of SDM College of Business Management, Postgraduate Center for Management Studies and Research, Mangaluru, I extend a very warm welcome to all the participants joining us today for this faculty development program on fostering brilliance, life skills for women's professional excellence. We are delighted to see the enthusiastic participation of faculty members, research scholars, and professionals from various institutions across the country. Your presence adds immense value to this program. The second session for today will focus on the importance of women's health and emotional resilience and life skills being the key enablers of professional excellence. In an era where women balance multiple roles and responsibilities, understanding and prioritizing physical and mental well-being becomes essential for sustained success and leadership. It gives me great pleasure to introduce our today's distinguished resource person, Dr. Hema Malya. Dr. Malya is a distinguished consultant obstetrician and gynecologist based in Mangalore with over 25 years of rich clinical experience in the field of women's health. She holds an MBBS and MS in obstetrics and gynecology and has been consistently dedicated to providing comprehensive, ethical, and patient-centered care. Her areas of expertise include antenatal and postnatal care, management of high-risk pregnancies, treatment of gynecological disorders, hormonal and reproductive health issues, PCOS management, to name just a few. She also expertises in infertility care. Known for her compassionate approach and strong clinical acumen, Dr. Malya combines evidence-based medical practice with personalized attention, ensuring the physical and emotional well-being of her patients. She has earned the trust and respect of the community through her commitment to excellence, professionalism, and continuous learning, making her a highly regarded healthcare professional in the region. Her professional journey and insights make her an ideal resource person for today's session. With this brief introduction, I cordially invite Dr. Hema Malya to take over the session and enlighten all of us with her valuable insights on women's health in all stages of life. Over to you, Dr. Malya.
Good afternoon, everyone. I'm Dr. Hema Malya from Mangalore. Thank you, Ms. Deepa Naik, for the introduction.
Ma'am, looks like you are still on mute.
No.
Okay, it's working. It's working. Yes. Good to
Okay. Am I audible now?
Ma'am, absolutely.
Yes. So today we are going to discuss women's health across all stages of life in 1 hour. That is from cradle to grave. We'll start with the most basic time, childhood and adolescence, which I'm going to cover the following topics: nutrition for growth, menstrual hygiene education, HPV, human papilloma virus vaccination, mental health awareness and preventing anemia. Menarche. Now, what is menarche? The first time the child gets periods, that time is called menarche, the first period, onset of first period.
Now, sorry to disturb you.
Yeah, yes, sure.
I think there's a slight disturbance at your end. Could you please bring down the volume level in your system? It must be 100%, because of which the audio is getting a little jarred. So if
Is
you
it
could
okay now?
bring down the volume,
Is it better? Is it better now?
Yeah, much better. Yes.
Yeah, sure. So we are going to go into menarche. What is the ideal age? Who would like to chat? You can. What is the ideal age for a woman, for a girl to get periods? Okay. The ideal age for a girl to get periods is between 12 and 14 to 15 years. Though nowadays we see a lot of children coming to the clinic with periods as early as 8 or 9. Now, the whole thing is being attributed to processed foods and a lifestyle in which we are exposed to a lot of adult content at a very early age. The next is frequency. How often should a girl get periods? Once a month, once in 2 months. Please remember, as long as the child is small, till she is 15 years of age, it doesn't matter if she's getting periods once a month or once in 3 months or once in 6 months. The whole thing is to give time to the period to regularize on its own. Flow. Coming to flow. How much is more, how much is less? We are actually not very concerned with the flow as long as the child doesn't have problems. How much flow is normal? 1 pad, 2 pads, 3 pads. If the child is comfortable and able to go about her day, yeah.
Hello, ma'am, the noise is still persisting. I think there is some issue at your mic. end. Could be that two systems are on. Will you please check? Or maybe if you could use a earphone, because there's a lot of disturbance. We are hardly able to hear your voice.
Oh.
Either the sound of the speaker could be reduced slightly. It looks like it's on full volume.
No, the speaker is on 50. The speaker is on 50. Is this okay now?
Is it against like that? To me, like Joyce.
Stop sharing my makeup.
The moment you start speaking, there's a jarring noise from your end. So possibly.
Is this okay now? Because there are no other
now
active.
we can't hear much of it.
There are no active systems.
Starts again, ma'am. The same thing happened the previous time also.
There are no active other mobiles or any other.
Yeah, now I think now it's fine. Now there is no noise.
There is let log out and log in is what they suggest.
It's still there.
Ma'am, will you log out and log in again? Could be.
Yeah, I think we'll do that.
Maybe.
I think we'll do that.
Yes, I think we have our resource person back on a different device. Welcome back, madam.
Am I audible now, Rashmi? Is it Deepa? Is it clear? Is it
Shall
clear
we
now?
begin?
Is this clear?
Yeah, we will play the PPT from our end.
Okay.
Yes, ma'am. I think you can continue. We had stopped at the slide.
I'm on mute. Can you hear me?
Yes, ma'am.
Can you hear me now?
Yes, ma'am. Now,
Echo, I think now. Is it clear?
ನೀವು ಮೊಬೈಲ್ ಈ ಕಡೆ ದೂರ ಇಡ್ವಾ ಇದಾಗ್ತದೆ
Leave. Miss Naik, can you hear me?
yes, ma'am. We can hear you.
Yeah, because the other device is giving an echo. Yeah.
We can hear you clearly, ma'am. I think we can
I
proceed.
can't do my slides.
We're
I want
getting
the
a
next slide.
green
please.
signal from the participants as well. Now there's no jarring or disturbance. I think we are good to go. We can continue.
I need the next slide, please.
Next slide.
Yeah. Coming to pubic hair, very commonly asked question by a lot of they shave, should they wax, should they trim, or do you need hair removal creams or lasers? Shaving is the most easy thing which is available, but for smaller children, we tell the parents do not let them shave at least till they are old enough to know what they are doing because they cut themselves very often, and a lot of kids do end up with folliculitis. The next thing is whether to wax. Even this is an option after the child is a major. Trimming is it's the easiest and the most cleanest procedure which is available. The last is whether to go for hair removal creams or lasers. The hair removal creams, remember, if you are using a cream on your hand and it is going to drop the hairs down within the next 20 minutes, just imagine the amount of chemicals which are there. Now, this thing can actually affect the vaginal skin. And remember, these things are mucosa, they absorb very easily. And these lead to cancers and other problems in the future. So please avoid hair removal creams in this. This is for women who are in the fashion industry, who regularly have to wear two-piece swimsuits. The lasers are where is very, very useful for these patients. Next slide, please. Yeah. Now, what to choose from? The parents do ask us, what do we use? Pads, tampons, menstrual cups. Pads are the commonest thing all over India. Majority of the patients use pads. So now we have a lot of, because of the internet, a lot of young girls experiment with tampons and menstrual cups. They come and ask us how, what, they clear their doubts. What is the frequency of changing pads? How often should you change a pad? Say, if the pad is not soaked at all or very minimally soaked, you can keep the pad on for up to 8 hours. But generally, as a rule, 6 hours is a good amount of time. The next is tampons. How to use? Use a tampon based on the amount of flow. The tampon is inserted by the patient on her own. As you can see in the picture, there are threads. Now the threads are to hold the tampon and pull it out. The plus point of a tampon is it's very easy to manage your day. But if it's a heavy bleed, sometimes it just does come out. What is the minus point of a tampon? The minus point is the patient is so comfortable that she actually sometimes forgets there is a tampon inside, because of which the patient can be brought in septic shock to us after forgetting to remove her tampon since the past 7 days. There is a foul smell, high fever. The patient is brought to the emergency with fever of unexplained etiology, no reason. Next slide, please. Menstrual cup. Advantages of a menstrual cup. Now, this is being used by a lot of college students. A menstrual cup is reusable for about 10 years. It's a plastic cup, first grade silicone. You have to wash it with warm water and soap. Remember, if a menstrual cup is not cleaned properly, it can be the source of infection. It's comfortable, it's leak free. Sometimes, though, we do have patients who come to our clinic saying, I inserted the menstrual cup, I'm not able to remove it out. Now, how do you remove it out? In such instances, we tell the girls, insert your finger and twist it, break the vacuum seal with the cervix, the mouth of the, just break it. Just turn the vacuum cup to the sideways and it will let go. Next slide, please. See, this is a small picture graphic representation of how to use a menstrual cup. You can see it, it's being inserted and it goes and clings on to the cervix or the mouth of the uterus, creating a vacuum, a suction, in which the blood accumulates. When you remove it, you dispose it and wash it with warm water and soap. Next. Period cramps, normal, abnormal. How to manage and when to see a gynecologist. The first question is why? Why period cramps? These are hormonal. They are caused basically by ovulation. How to manage? Mild period cramps can be managed by over-the-counter medication. When to see a gynecologist? The time to see a gynecologist is when it is affecting the day-to-day activities of the child, or the girl. They have vomiting, can't get out of bed, and need to lie in the whole day. Now, this is when you see a gynecologist to rule out what other causes can cause the period cramps. Next. Coming to premenstrual symptoms, premenstrual syndrome. This is a set of symptoms which starts particularly about a week prior to onset of periods and ends immediately with the onset of periods. When the period starts, the symptoms subside. Next slide. Yeah. So the common symptoms of premenstrual syndrome are mood swings, where the children can even feel suicidal. They cry without reason. Anger issues with parents. Parents don't understand. They feel I'm doing everything right. Why is she shouting at me? The cramps, the headaches, the breast tenderness, insomnia, sleeplessness, fatigue. Finally, it is attributed to she is spending too much time on the mobile. That's why she is angry and irritated. It's not that. It is part of premenstrual symptoms. Now, how to go about this? Encourage the child to have an active lifestyle, move more. They need not, go to the gym or something. The basic premise is to move more, to avoid alcohol and smoking, medication if nothing else works, and calcium and omega-3 supplements. These are usually started, say, about 10 days prior. 10 days prior, we ask the patient to avoid more of salt at this time. Next. Next problem faced by children and women in general, white discharge. Normal or abnormal? Is white discharge normal? White discharge, how do I go to this?
Yes, ma'am.
Yes. So white discharge is normal sometimes, not always. When is it abnormal? Question. When it is smelling bad, when there is itching, and the third thing, when it starts showing color or a copious amount because of which the patient has to change her underwear every 2-3 hours. This is when you need to treat the white discharge. Just remember, most of the time, white discharge in a small amount, without smell, without itching, is normal. This happens just before ovulation or a few days prior to the onset of periods. Next. Coming to menstrual disorders in adolescents, we have 4 common disorders: heavy bleeding, most common, irregular periods, no periods, and the last and the most common now, the polycystic ovaries, PCOD, PCOS. Coming to heavy bleeding, the most common cause of heavy bleeding are hormonal. If the patient is bleeding more than 5 pads per day and the hemoglobin is low, we definitely need tablets to control the bleeding. We get an ultrasound done and we get the blood test done. And then, depending on the age of the child, we decide between norethistérone and combined oral pills to control it. Irregular cycles, like I told you before, you don't need to correct the periods till they are at least 15. Let them regularize on their own. Do not add hormones to children. If they are not okay by the time they are 15 or 16, then you need to get them to the gynec. The next is no periods or amenorrhea. No periods at all. How long is it normal to wait for periods to come? When is the first period? How much can you wait? Up to 14, 15, 16 years. How long do we wait? Till 14. Okay, somebody's replied till 14. 14. So you can wait up to 16 years in girls. Primary amenorrhea, most of the time you wait till the child is at least 16. Once she is 16, if she has still not bled, you need to do an ultrasound and a hormonal profile. What the ultrasound will tell you, A, whether there is a uterus or no uterus, because there are a lot of genetic disorders where the external, the vagina is normal, but there is no uterus inside, or whether there is polycystic ovaries, which is causing a abnormality. Yeah, one of the chat box questions says nowadays girls are getting period early. Yes, most of the time this is because of the processed foods and the diets we eat. Almost all the children are addicted to eating outside or ordering in from inside. I'm not just blaming the children, we parents are also to blame. We get a lot of food from outside, the heavy intake of salt, the stress, and the exposure to adult content online at a very, very young age. Things probably we did not know till we were in 9th or 10th. Children as young as 8 or 9 years know everything about periods. Going to the next topic. Polycystic ovaries, PCOD. Now the common question is, what is polycystic ovaries? It is nothing but a condition where the ovaries, the place from which hormones are generated, starts giving up high levels of testosterone, a male hormone, because of which women tend to grow facial hair where men grow frontal balding. You never see a man with balding at the behind, it's always in the front. Balding, excessive hair growth, easy putting on of weight, and centripetal weight gain around the abdomen. What is the difference between polycystic ovary disease and syndrome? Now, between the two, I think it just gives a headache to the patient. Please call it polycystic ovaries. It's a condition. The minute you say disease or syndrome, you are putting the patient into a fear mentality. The next thing they'll think of is Google and see what problems can come from this. Polycystic ovary disease is a condition which is easily reversible here, polycystic, by a simple weight loss of 5% of the body weight and a very clean diet where you avoid dairy and you avoid processed food. Dairy and processed foods are out, and a hormonal test should be enough. The second is polycystic ovary. When they say syndrome, the word includes a hormonal imbalance such that it needs medication to resolve it and puts the patient at a higher risk of getting diabetes in the future. Next slide. Childhood 0 to 12, you need an adequate nutrition for growth, prevention of anemia, worm infestation. Almost all schools give the deworming tablet once a year to the children. Immunization schedule with focus on HPV. HPV is human papilloma virus. It is a risk factor for cervical cancer. Cervix is the mouth of the uterus, remember. Hygiene, skin, teeth, genital hygiene. Like I said, you have to teach your children that you have to trim the hairs, keep it clean down there, and tell the parents if there is itching. Prevention of childhood obesity. Like I said, most kids are glued to their mobiles. Physical activity is very, very important. And lastly, early detection of congenital disorders. Next. Adolescence, the next, the problem period, the 13 to 19. Puberty changes, menstrual hygiene, screening and management of anemia. Like I said, if the bleeding is very, very heavy, then you definitely need to give them iron supplements. Mental health awareness, stress, depression, bullying overweight. Very, very, very common where, children are brought to me by the parents. I had one girl who had literally gone into anorexia. She was 5'6" and weighed only 42 kilos. The only thing was people started bullying her that, she is overweight, and she stopped eating after that, went into anorexia. And then she started feeling good about it because people said, you are size 0. Then the period stopped. She was brought to me because she did not have periods for a period of 8 to 9 months. It took a lot of counseling to get that child back on track. Nutrition, calcium, iron, balanced diets. See, calcium and iron supplements are not exactly needed if the child is having a balanced diet. Sexual and reproductive health education. Nowadays, most schools do call gynecologists to give talks to explain to the children what is periods, how to manage, what to do. And the children themselves are quite open to asking us questions when we go to schools and explain to them. They have their own queries, issues. Is this normal, not normal? And no, I don't think any other child judges them either. They're quite open about it. And lastly, the HPV or the human papilloma virus vaccination to prevent cervical cancer. That is now given routinely. The best time to give the HPV vaccination is usually, the pediatricians will say 9 years. So personally, I feel a time just before they get sexually active is the best time. So I do not recommend the vaccine usually until the child is at least 14, 15 years. It's a good time to give the vaccine. Because in India, compared to abroad, the children do not start dating so early as 9 and 10.
Recording in progress.
Yes. Coming to the next thing, contraception in adolescents. Now, this is something which most people would want to push under the sheets. Nobody wants to talk of it, though we have a huge population of children in the age group of 18 to 22, 23 who are sexually active. So, this is one topic you really need to address, especially in college students, because the number of students coming with unwanted pregnancies is quite high. Morning up, suppose they have had, the question is, what do I do? They come and ask us, I had sex last night and it wasn't intentional, but what do I do?
Recording in
A steady
progress.
relationship. The birth control pills. How to take them is every 21 days, every month. And they have their pros and the cons, which will be explained when they are given. And the cons, which will be explained when they are given. Patients, married or unmarried, anybody above the age of 18 years can learn how to take them. Next. The Medical Termination of Pregnancy Amendment Bill 2021 question is, how long can you wait for an abortion and up to how long can you abort? By the Supreme Court the Supreme Court judgments, the medical termination of pregnancy is permissible now up to 6 months of pregnancy. The only rule is married or unmarried doesn't make a difference as long as it's not a rape. And they can terminate up to 6 months. Up to 2 months, it is by tablets. Up to 3 months, by suction evacuation. And lastly, from 3 to 6 months, by delivery. No male partner's consent is needed for a medical termination of pregnancy. Okay, it has to be done in a proper setup, supervised and done by a gynecologist so that the patient doesn't get infected in future or has problems in conceiving in future. Married or unmarried doesn't make any difference to the procedure. Procedure is legal even if the patient is unmarried, provided it is not a rape. Name and other particulars of a woman whose pregnancy has been terminated cannot be revealed to anybody except by a person authorized by the law. Next. Ovarian cysts in adolescents. It's very common between 12 and 18 years. Most of these patients are brought to us with pain abdomen. Now you can see ovarian cysts. I have shared two pictures. One is ovarian cyst which I had operated, a large ovarian cyst, say about 7 or 12 centimeters. Simple cysts do not do anything, they are just there. Leave them alone. They will resolve on their own. If after 3 months they have not resolved, then you put them on birth control pills for 3 months. Birth control pills are known to shrink simple cysts. The common causes are pelvic pain, they come with urinary frequency. The worst case is a torsion. If it twists, the cyst twists on itself, then we have an emergency leading to an emergency surgery to remove the cyst. Next slide. Coming to polycystic ovaries. See, you can see typical hirsutism, acne, balding, and irregular periods. In these women, it is very, very important to keep the periods regular so that they do not face any problems in getting pregnant in future. Next. Coming to fibroids in the uterus. Signs and symptoms. Now, this is across the age range of 20 to 50 years, 60 years. Many women have fibroids in their uterus. Signs and symptoms. 90% of the time, these fibroids are quiet. Nobody knows them until the patient goes for a scan for some other reason. See, I have a question from Ms. Kulkarni. Said, how can the periods be kept regular? The first thing is, if the patient's weight is, if she's overweight, she needs to keep her weight down. If the weight loss occurs, automatically the hormones start coming in sync. And if the patient is slim and this is not the case, then the patients need to be given hormonal tablets to regularize the periods, or non-hormonal tablets based on her blood reports, which is the hormones. Coming to fibroid uterus, treatments available will be medical or surgical. Medical will be with tablets to shrink the fibroids. Myomectomy or removal of the fibroid surgically, or hysterectomy. Now, this is not an option for kids, okay? This is an overlapping subject because of which the word hysterectomy has come here. Hysterectomy is for that woman who is bleeding, is not controlled, and the fibroids are so large that she's having difficulty in passing urine. In such cases, we advocate removal of the uterus. Next slide. This is a picture which you can see laparoscopically, multiple uterine fibroids. This is the uterus, and small satellite-like stuff growing on it is the uterine fibroids. Next. This is a picture depiction. That is a uterus, two ovaries white colored on the sides, and all different kinds of fibroids, which are growing like bunches of grapes. Next. See, what you can see, what I'm holding is a fibroid, and the thing below my fingers is the uterus. The small thing is the uterus, which is hardly 4 to 5 centimeters. And the whole thing, which is held by the screw, is a fibroid. The next picture, please. Yeah. What I'm pointing at with my fingers is where I have removed the fibroid and sutured, and that is the uterus, as you can see. Next. I have a question in between. Does removal of the uterus impact the lady mentally? Yes, it does. In two ways. One, psychologically, we have been programmed to believe that, as long as you are bleeding and menstruating, you are young. So automatically that psychological thing that, oh, maybe I am old. Second, hormones suddenly go from a peak to base levels. They just drop, because of which mood swings are very common. Sudden menopause, it's not a natural menopause. We have removed the uterus artificially, because of which to put forever young. They used to put hormones for menopausal ladies to keep them young. The net result was we had a huge load of women with breast cancers. So remember, avoid hormonal treatment after your menopause as far as possible. I have one more question here from Ms. Ramchandra. What is the difference between cysts and fibroids? Now remember, the cysts come only in the ovaries. The fibroids grow all over the uterus. Cysts secrete hormones. Fibroids are just muscle growths. They do not secrete hormones at all. Now, reproductive age for the 20 to 45 years people. Family planning. What are the contraception options available? There are different options available now. One is the birth control pills. Simple, effective, almost 99% foolproof. But minus point is the patient needs to remember to take them every day without fail. The loop, the IUCD, or the intrauterine contraceptive device, which is put inside the uterus, you get hormonal and non-hormonal. Non-hormonal variety is cheaper. The hormonal variety regulates the bleeding. So if you have a woman with heavy bleeding, we put a loop called the Mirena inside. Secretes hormones which reduces the bleeding. Side by side, it gives contraception. The STI, sexually transmitted infections, and early treatment. Patients come to us with rashes, needs to be seen to be treated. At this age, you need to learn how to do a regular breast self-examination and clinical examination. I will be showing the slide in the coming slides. Maintaining a healthy lifestyle, diet, exercise, sleep, screening. At any person who's sexually active needs to get a pap smear done once a year. A thyroid profile and a hemoglobin are mandatory every year for all ladies. Next. Before we go to preconception and pregnancy, I have a question saying if periods are regular after 40, does it ensure healthy eggs? Sometimes, yes. Not all eggs. Remember, the best quality eggs are before you are 30. But it doesn't mean that once you're 40, I have had many women, and in the pregnancy, you have antenatal care, diet, exercise, monitoring, high risk pregnancy screening. They need to go for at least 8 checkups in a pregnancy. Once a month is ideal. Mental health during pregnancy, mood swings, they are very common because of hormonal imbalances in the first 3 months. Women can have mood swings where they are crying without reason and they're extremely happy without reason, either way. And safe delivery practices. Please make sure your wife, mother, child, whoever gets good access to a gynecologist. Next. Pregnancy and PCOD. Now, for a patient with PCOD, is the pregnancy the same? Absolutely. The pregnancy is absolutely the same. You treat the patient just the same, whether she is a normal patient, PCOD patient. Once she conceives, the treatment is the same, and the PCOD patient can go for a normal delivery like all others. For these patients, we tell them keep cycles regular, PCOD patients, to become pregnant and weight down. Cut out dairy, sugar, and processed foods. Increase green vegetables and nuts and increase the water intake. Next. Coming to preconception and pregnancy, they are asked to take folic and iron prophylaxis, complete antenatal care, monitoring of high risk conditions like hypertension, sugar, anemia in pregnancy, ultrasound screening, at least 3 ultrasounds in the pregnancy, the third month and the fifth month being mandatory. The third month to make sure that the baby is not mentally challenged. That's the only time you can find out in a pregnancy whether the baby is mentally challenged or not before, not after. It's called the NT scan, the nuchal translucency scan. And nutritional needs, protein, calcium, omega-3s, getting them prepared for birth. You tell them pregnancy is not a disease. You're just pregnant. You go about it such that go through your normal routines such that delivery is a process. Okay. And I have a question here. It is said you can have paneer to increase protein. Yes, paneer is a source, but it is not the only source. And in most conditions with PCOD, we tell them.
Recording in progress.
The next slide, please. Yeah, care in pregnancy. Eat a varied diet. Avoid fruits like papaya and pineapple. Drink about 2 liters of water every day. Take your supplements properly. And do not skip meals. Coming to exercise in pregnancy, the safest exercise in pregnancy is walking, brisk walk, not on a treadmill because you can lose your balance. Keep yourself very well hydrated. Next. Next slide, please. See, these are basically the essential nutrients. Folic-rich foods, iron-rich foods, fiber-rich, vitamin D foods. Next. Coming to labor. Now, when going through labor, it is very important. I make sure that my patients have their spouses or their mothers inside with them when they go through labor. It's very important for the spouse to see the amount of pain that the patient is taking. It bonds them together. They should be there when the patient delivers. The next is now our latest thing is painless labor, epidural. What's painless labor? So the question with painless labor is it's an option which many women do opt for. A small spine needle is put in the back and a drug is injected, because of which you do not feel anything. The labor pains come and go, but the sensation is stopped. Advantages, it's a very nice way to give birth normally without pain. And post delivery, even when we stitch the episiotomy, the cut which is given down, there is no pain. The patient can't feel anything. It is kept for 24 hours post delivery. Disadvantages, sometimes the patient is so relaxed, no pain, that she won't push at all. She will relax and sleep. Fully open uterus and the patient will not push. In such cases, we usually cut the epidural in the end so that she can feel pressure and push. Next. Okay, I have a question here from Ms. Kukreja which says, what is the reason for avoiding papaya and pineapple? See, there are no 100% specific reasons. There are a lot of patients who enjoy eating papaya and pineapple and nothing happens. But papaya, especially raw papaya and pineapple, are known to have slight amount of abortifacients in which in a sensitive individual can cause a miscarriage. So it is when in doubt, it is better to avoid. Now here you can see how an epidural is being given. The patient is put in a position, fetal position, and an epidural is given into the back. The catheter is as thin as a patient's hair. Next. Postpartum and lactation. Post-delivery, remember, patient needs a lot of support post-delivery because this is the time when the hormones drop again and the patients, along with loss of shape, they are going through a lot of mixed emotions where everybody who's delivered once seems to give free advice saying that, do this, do that. Sometimes all they want is support. They don't want advice. Support them in the best way they can and in, help them with the feeding, the lactation. If it's difficult, get a lactation counselor to help them with the feeds. Depression because of sitting inside. Some women do come and tell me that, doctor, everybody says I should be very happy, everything is good with me, but I don't know why I'm feeling depressed. This is a hormonal change. Remember, proper counseling can actually help these women come out of this depression. But if it is left unchecked, there have been patients who have committed suicide because they are not able to grapple with the feelings post delivery. Pelvic floor strengthening. Last, pelvic floor strengthening exercises should be taught to a patient so that the vagina after normal delivery bounces back to strength and not becomes lax. Contraception after childbirth, what to do so that you can keep a gap between the children. Like I told you can suggest all kinds. The implants which are inserted under your skin in your arm, or the IUCD, the loop which is put inside your uterus, or birth control pills. Next. Next. Coming to post-delivery, now the children have grown up or they are growing up and we are looking at perimenopause and menopause. Perimenopause is the time when most women are going through these irregular cycles, mood swings. First 2 months, the periods are fine. Then 3 months, no periods. Again, 2 months, they're regular. Hot flashes, mood changes. Bone health at this time is very, very important. Tell the patient to take calcium and vitamin D as a must. Their cardiovascular risk increases. Remember, the estrogen progesterone hormones in women make sure that they don't get, you rarely hear of women getting heart attacks in younger ages. That is because the hormones estrogen and progesterone are protecting them. With menopause, the estrogen progesterone support is gone, getting them the same risk.
Recording in progress.
I am 48 years. So, 48-year-old and have one fibroid, which is huge, is 6 into 7 centimeters with regular periods and heavy flow for at least 2 days. So heavy that it's difficult for the patient to move. It is near menopause age and the hemoglobin is around 8. Can this be treated medically or surgical only? See, always your first option should be the medical option. First option, because you're near them, there are a lot of tablets available now. You have mifepristone tablets which are given to women. They stop the periods and shrink the fibroids. They are given for a period of 1 to 2 years, during which the fibroid will shrink. Mind you, the fibroid will never go. It will shrink, probably pushing you into menopause by the time you're 50. The fibroid is going to shrink. Your bleeding is going to stop in these 2 years. And once the fibroid shrinks, the hemoglobin will increase because you're not bleeding. So the first option is always oral tablets, medicines. Doesn't work, then you go with surgery. Care pre and post menopause. Now, after 40, get a pap smear done once a year to rule out infection, mammography, regular exercise, get a thyroid check, calcium, vitamin D supplements. When is the time? Suppose you are menopause. So what is menopause? You go through 1 year with no periods. That is menopause. After that, if you bleed, that is the time you have to rush to the gynecologist immediately. That is not normal. So when you're in perimenopause, keep a diary in which you write down, or a mobile app in which you write down which day you had periods, when to when. If it's more than a year and then you bleed, you definitely need to go to the gynec ASAP. Next. Pap smears and pelvic examinations. Do you need them and how often? See, pap smear. Next slide, please. See, this is how a pap smear is done. What you can see is a speculum which is inserted. There is a uterus and something like an earbud which is cleaning inside. What it does is it takes a smear and looks for abnormal cells. Next. Perimenopause, you have fluctuating hormones, diet needs to be taken care of, strength training is needed, and calcium needs to be added because most women in India start calcium after they have a fracture. After they have a fracture, remember, you need to start supplementing earlier. By the time you are in your early 30s, late 30s, you need to start the calcium. Screening is for PAP, mammography, and lipid profile, and addressing urogenital symptoms where you have incontinence, where patients post, when they laugh loudly, I have urine leak. When I cough, I get urine leak. It's embarrassing. Or I go to the washroom. Before I reach the bathroom, the urine is out. All these kind of things need to be examined and then dealt with. I have a question from Dr. Desai, which says, at around what age does menopause start? It can start as early premature menopause in age of 35 to women as late as 55, though the most common age is the 45 to 52 years. And there is one more question that says, what if I get periods in 2 months at the age of 42? Good for you. I wouldn't bother. As long as you're not pregnant, it doesn't matter. Once in 2 months is also okay. Just keep a track of the period. It will start getting slower and slower, and maybe once in 3 months, then 2 months regularly. Let it slow down at its own pace. Do not interfere unless it's a heavy bleed. Next. Menopause, like I said, hot flushes, sleep disturbance, HRT guidelines are there, which is given only hormone. Okay, osteoporosis prevention, calcium, vitamin D supplementation, sexual health. Women, you have special lubricating agents which can help them. Preferably avoid hormonal. Mental and cognitive health awareness, keeping themselves active, having an active lifestyle, meeting people outside. This is a big advantage for working women that every day you have to. It is like the patient who once told me, Doctor, I don't care about it. I have to get up, put on my lipstick, carry my handbag, and go to work because that keeps me alive. So I have more questions here, which says at the age of 36, my periods reduced to 1.5 days cycle. It happens every month. Does it mean I'm nearing menopause? No, it means you have a normal cycle. Like I said, it doesn't matter whether you're bleeding 1 day or whether you're bleeding 5 days. It's regular, you're bleeding less. Menopause is when they become irregular and bleeding, not less bleeding. Less bleeding is fine, that's normal. And after 40, if period occurs once in 20 days, is it menopause? No, it's perimenopause. Now, if it is very heavy, then you need to go and meet the gynecologist. Otherwise, no, it's not menopause. Next slide, please. Coming to the last topic is cervical cancer. Very, very common because now we hear everybody talking about HPV vaccination, cervical cancer. You have all celebrities coming out. Cervical cancer has been there since ages. All the publicity now is because we have started making the cancer vaccine in India. Because I've had a lot of patients, only those whose families have had somebody with this cancer will know about it. Majority don't. Cervical cancer does not come heredity. It comes by a virus called the human papilloma virus. It's sexually transmitted. If a woman has never had sex, she will never get cervical cancer. End. She need not even take the vaccine. Next slide. Risk factors for getting cervical cancer are human papilloma virus infection, HIV, herpes, smoking, multiple sexual partners, birth control pills for a very long time, more than 10 years, multiple deliveries, because every time she delivers, it damages the cervix of the mouth of the uterus. Next. Signs and symptoms, how do they know? See, they have a vaginal bleed between periods or postcoital bleed. After having sex, they start bleeding. Excessive white discharge, sometimes blood tinged, and unexplained pelvic pain. Next. See, here how we do is they will end up with the gynecologist. We get a scan done, we get a pap smear done, we see inside the mouth of the uterus if there is any problem. I have a question that says, which is the right age for HPV vaccination? Vaccine can be given to any woman woman between the ages of 9 years and 44 years. We avoid the pregnant and the lactating women. And the right age for vaccination, I would say, would be around 15 years for girls. Because unlike the West, our children do not start dating at 9, 10, 11. Because of which the best vaccination is given before they are sexually active. And I think 15, after 15, there are 3 doses. Till then, there are only 2 doses. So, in the benefit of the kid, I'd say 15 is a good age. Treatment will be in early stages, radical hysterectomy, and the last stages, of course, chemotherapy. Next, because cervical cancer, if you do not screen regularly, by the time of they find out they have cervical cancer, they're already in stage 3 or 4, which makes screening very, very, very important. Next. Screen pap smear is done in sexually active women once a year for 3 years, and if 3 smears are clean, then once in 3 years. Next. This is a picture. We've had a similar picture before. This is how a pap is done. Next. Cervical cancer vaccine. You can see how cervical cancer looks like. Next. Vaccine efficacy. It is very, very, very effective. Now, dosage. Before the age of 15, it is 2 doses and 3 months apart. And after the age of 15, it is 3 doses for a period of 6 months. I have a question here which says, if after 3 days of regular menstruation, if spotting continues for 7 days, is there any issue? So if it's a one-time thing, you should not worry. But if it is continuously like that, yeah, definitely you need to get your ultrasound done and the hormones checked. One more query which says, now unrelated to our cervical cancer topic, it says, I heard usually once you stop breastfeeding, milk becomes hard and leads to breast cancer after decades. Is it true? No, not. There is no way to stop the milk, and milk has to stop when you stop feeding. And milk is stored in the human breast for periods of 8 to 10 years. So, no, it doesn't lead to breast cancer at all. Next, does vaccine affect sexually active women? No, not at all. The vaccine is very effective in sexually active women also, but the efficacy is more if they take it before having sex. Because by the time if you are sexually active already, say you are say 38 and you're taking the vaccine, you've already been sexually active, probably already exposed to the virus. You've already been exposed to the virus, the protection is good, but it is not 100% like how the given to kids. Next. Next slide. Yeah, like I said, best effects seen prior to onset of sexual activity. How is it given? It is given like TT injection, tetanus, intramuscular. Next. Side effects, injection site pain, nothing else happens. Avoid in the pregnant and lactating women. See, how to do a breast self-exam. Stand in the shower or in front of a mirror. Examine the breast in the mirror with arms up, down, and on your hips. Stand, move your fingers. Generally, the left breast is slightly larger than the right one. Move your fingers all around the breast, ending with the nipple. Squeeze the nipple and check if there is any discharge. If there is discharge, you definitely need to get yourself checked. Next. Senior women coming to the 65 plus years, fall prevention, bone health management.